Alright, so this is my clinical teaching presentation on low back pain. First, the learning objectives are for viewers to be able to list 3 prevention strategies for avoiding chronic back pain and to be able to list 4 causes of chronic back pain and to describe the ways to treat and manage chronic low back pain. Here are the pretest questions. I'll include them on one slide just to try and save some time. So feel free to pause this and just read through them and then just look for the keywords so you'll know what to look for throughout the presentation. And then looking at the anatomy is a good way to kind of understand how complications arise in the low back. The thing we're focusing on here is this low back that's made up of what we're looking at is 5 lumbar vertebrae and the discs and nerves that are in between them. And you can see the curvature on it, and when it's got like an irregular curve like this and the rest of the back goes the opposite direction, what happens is when somebody like bends over with that inward curvature and they press that force, when they pull, all that force is going up on that low back, and it's just pushing it in like the opposite direction. That causes all of those nerves and discs just to get like just pinched together, and that can cause just a ton of pressure on the low back, and that's how a lot of complications arise. So for causes of low back pain, it can be congenital, like a skeletal irregularity like spina bifida. What people commonly think about is like just injuries like sprains, strains, and then just from general trauma, whether that be like a car crash or maybe like a sports injury. And then you can have degenerative problems as well from just that constant like rubbing together. And then there's also nerve and spinal cord problems, like when all that rubbing together happens, then the nerves can become like compressed between the bones and the discs, or there can be infection and inflammation too. Ways we can help prevent chronic low back pain would be regular exercise. Kind of the regular part there is pretty important, because if you do strenuous exercise after being sedentary for a long time, that can almost make you more prone to an injury. So the regular exercise helps you keep your muscles strong and flexible. And also maintaining a healthy weight is going to be really beneficial in prevention, because just not having that excess weight can help reduce a lot of pressure on the low back too. Also, switching your seating position periodically is also going to help reduce any pressure on just like one particular spot. Sleeping on your side is probably the best sleeping position for your back, especially with like your knees that are kind of in that fetal position. Helps relieve any pressure and compression in that low spine. And also, quitting smoking helps with pretty much everything. Treatments for chronic back pain would include medications like analgesics, NSAIDs, and antidepressants if the pain has been chronic for a long time and is causing like some mental stress. Self-management, things like that would be heating, icing, and then just exercise to help maintain. Complementary and alternative treatments, things like acupuncture, chiropractic, and then traction. Traction is just basically just stretching out, we'll be stretching out that vertebrae to help alleviate any compression in the spine. And then there are a lot of different surgeries and operations you can get if the problems progress too far before you can do anything else for them. Things like a vertebroplasty, a spinal fusion, and then disc replacement. And then here are the post-test questions now. I'm gonna go through these pretty quick. You can pause it and then check yourself by downloading the PowerPoint and looking at the notes later. So and that's pretty much it. Thank you.